Welcome to Arab Center, Washington, D.C. My name is Khalil Jahshan. I'm the Executive Director of the Center, and I welcome you to this special conversation, special interview, focusing today on humanitarian work in the Middle East, particularly the work of an organization that's dear to many of us called ANERA. So we would like to introduce ANERA to you through the eyes of two of its senior representatives in the region, the director of the country director for Lebanon and the country director for Palestine. By way of introduction, let me say that the Arab-Israeli War of 1967 left hundreds of thousands, indeed left about 325 refugees as a result of that particular war. And about 145,000 of them actually were refugees for the second time in their lives because they became refugees in 1948. Now, these thousands of Palestinian homeless and impoverished attracted the attention of many people around the world. And as international agencies began to focus on this dilemma, the issue of the refugees, the 1967 refugees, a small group of Americans here in the United States began working together to provide immediate help to the victims of this conflict. The result was the creation of an outfit that is known to many of us, American Near East Refugee Aid, known shortly as ANERA. And from modest beginning in 1967, over the past 50 years, ANERA began its committed work to essentially respond to the critical humanitarian needs of not just Palestinian refugees, but also other refugees and disadvantaged in neighboring countries, including Lebanon and Jordan specifically. Now, since 1968, ANERA has helped refugees and others hurt by different conflicts in the region, particularly, as I said, in Palestine, Lebanon, Jordan, to give them a little bit of hope in their daily lives. ANERA, as most of you know, is an NGO, a non-profit organization. It is non-political, it's non-religious affiliated. And it simply focuses on the humanitarian needs of the Palestinian refugees in Palestine, i.e. the West Bank and Gaza, on the refugees in Lebanon, on the internal refugees, Lebanese citizens also that have their own need as a result of the collapsing system in the country, in addition, of course, to Jordan. So the work of ANERA is essentially emergency relief, sustainable help in the areas of health, in education, and in economic development. ANERA staff, which we have been blessed to witness it grow to the point, I think we have, about 130 employees in ANERA in Washington, in Beirut, in Ramallah, in Gaza, in Amman, in Tripoli, in Lebanon in north, in the Bekaa Valley, and in the south. So we have a sizable staff, making ANERA one of the most influential American humanitarian organizations in the region. And of course, with that diversity, there is a big challenge. They are working under these 130 employees, particularly those beyond Washington, are working under very difficult circumstances that make it quite challenging to essentially introduce that element of hope to the needy people in the region because of the continuing conflicts, the constraints imposed on the programs and on the employees of ANERA to implement the programs that are approved by its board of directors. Yet, I'm happy to say that despite all these challenges, ANERA today, this is very impressive, has surpassed $112 million raised this past fiscal year, 2021, to get that help, that humanitarian help, to those who need it in the region. That's very impressive by any standard. Now, to help us understand the work of ANERA, to help us understand the nature of that work and the broad nature of that work. We have with us two special guests, like I said, the country director of both Palestine. First to my immediate right is Sandra Rasheed, and also to her right is Samar Yassir, the country director for Lebanon. Sandra has essentially worked in the development field for many years. She has spent the past 28 years, actually, working in this line of work with both national and international organizations. And she has managed tens and tens of projects and work with such donors as USAID, the EU, which is very committed and very involved, actually. The EU is more involved probably than the US in humanitarian aid in Palestine. She's worked on and provided oversight for programs in the fields of children, youth, education, water, environment, community development, food security, and agriculture. Also in the field of human rights, good governance, and capacity building in the region. She's a graduate from Eastern Washington University with a bachelor's degree in English literature, and she also earned a master's degree in sustainable development from World Learning School for International Training in Vermont. Samar, who heads the program in Lebanon, has been ANERA director since 2011, and responsible for ANERA's work during very important and difficult times in Lebanon. Of course, Lebanon never runs out of difficult times. We continue to do that today, and she will help us try to understand some of the challenges we face in Lebanon today. And that includes working on educational project, sports programs for vulnerable adolescents, health issues, relief access for impoverished families, sustainable community development in refugee camps and outside the refugee camps. Samar is very experienced in development work and has worked in Lebanon in this field of social development, as we said, more than 20 years, all these years with ANERA, and even preceding that. She has worked with civil society organizations to promote human rights, democracy, gender equality, peace and conflict in the region, and so on. She has managed programs for different organizations in Lebanon before ANERA, beyond that, like UNRWA and Impact over the years. She's a native of Beirut and is a graduate of AUB, American University of Beirut, and has a postgraduate diploma from the University of London's Institute of Child Health. Welcome to both of you. I appreciate you taking time out of your busy schedule for the annual meeting here of ANERA, and to be with us today to help our constituents, our audience that follow news from the Arab Center regarding this very important humanitarian work that you're doing in the region. Now, you both work in totally different environments. In your case, you work in Palestine. In your case, you work in Lebanon. Would you like to tell our audience the unique challenges that you face in Palestine, the unique challenges you face in Lebanon, in the sense that you can't use a shotgun approach? In other words, what applies in Lebanon might not apply in Palestine, and vice versa. So as you do ANERA's mission in the region, what is unique about the needs in Lebanon today? Let's start with you.
First, I want to thank you, Khalil, for hosting us and to speak about the important work we do in the countries that we serve. You asked about challenges and how do we work within these challenges. We survive and we serve because we adapt. I think this is one of the most important things we do at ANERA, and this is why we are able to expand our work and make a difference. Mm-hmm. We pave the road for hope in these countries because we learn to adapt to these challenges. I'll give you one example. We have been living in Lebanon in the past 2 years in the most severe economic crisis that hit Lebanon. It's labeled as the number one crisis worldwide, right? As
Yes.
any country, the value of the Lebanese pound has dropped more than 90%. It lost more than 90 of its value. And suddenly, more than 70% of the population of Lebanon has become labeled as poor, below the poverty line. So new vulnerabilities, new poor now emerged in Lebanon. And these are the teachers, the nurses, the middle class, of Lebanon has been hit. And so you have this as at one side. So the scope of our work and those who need our help has expanded in number. But at the same time, the whole public service has collapsed,
Yes.
So you have to work and deliver with no electricity. We get 0 to, if we're lucky, 1 hour of electricity from the grid. And this affects internet, road blockage, so really, and the banking system, because we depend on the banking system for any transactions, right? So with all these challenges, we learn to adapt. Is it easy? No, of course not. We spend all the time replanning and discussing how shall we do it. And we find ways of reaching the help and support the communities we support. So adaptation, being flexible and being responsive. This is how we learn to do it.
That's a trilateral formula there. Very good. Let's move to Palestine. Okay, her situation in Lebanon is essentially the collapse of the system. The system has imploded, which makes it very difficult to function. What's the situation in Palestine? What's the main challenge you face there?
Thank you, Khalil and Arab Center, for allowing us to speak about ANERA's great work and what we're doing. For us, I think we have to remember that Palestine is the longest occupation in history.
Yes.
And living under occupation since 1967, but dealing with the catastrophe in the Nakba since 1948, the challenges are the same challenges that we've always faced, that we are a people living under different governmental systems, under different laws and regulations and policies, that we have to figure out how to do the kind of work that we're doing within there. So if you've ever been to Palestine, and I know you have, but if you're in Palestine, we have three different major locations. We have the West Bank. We consider East Jerusalem as part of the West Bank, but that's a different location, and then Gaza. And each of these areas are governed by a different government. So we deal with 3 different governments in this very small area of land. We deal with the ministry, with the government of Israel, we deal with the PNA, and we deal with the de facto in Gaza. When we do our work, it's extremely challenging to see how we can develop the best, how we can develop work and the ways that we're working to ensure that we're reaching the most marginalized and most vulnerable people in these areas. In the West Bank, you have issues with demolitions and settlements and military checkpoints. In Gaza, you have a blockade that's been happening for 16 years. In East Jerusalem and Jerusalem, you have a situation where people are under the government of Israel, but they're secondhand citizens, and they have higher taxes. If we want to do development, we can't build schools because building is not permitted. We can't do the kind of economic development because there's laws and taxes and regulations that we have to abide on. So it's extremely challenging situation when you think of Palestine. You're dealing with Palestine in three parts. And the kind of work that we do, whether it's in water and sanitation or health and education, really depends on the area that we want to work on. The economic crisis, the global economic crisis, yes, in Lebanon it's extremely exasperated, but there's an economic crisis happening in Palestine. We have 67% of our population is youth, and the economic unemployment rate is up to 46%. We have over 2 million people living in the largest open prison in history, and 2/3 of them are refugees. And as you said, refugees two times over. We have 500,000 people living in 8 different camps in Gaza. So you have the sanitation, the health situation is very dire for these communities. So it's a very challenging context that we live in. And you mentioned the hope several times, and it's exactly the work that ANERA wants to do. And it's part of our what we say is ANERA, where hope finds a way. And this is what we're trying to do under these challenging circumstances.
Yeah, the mind-boggling aspect of your work for typical American citizens is the space we're talking about, whether it's Palestine, the West Bank and Gaza, Jerusalem included, or Lebanon. We're talking about probably both countries together are smaller than the smallest of American states.
Yes.
So that must be a challenge. But in your case, to add insult to injury, in addition to that difficulty, which fine, you can go do health projects, water processes to help people get water and so on, but not under foreign occupation.
Yes.
So you are functioning under an occupation that governs these territories and tells people what to eat, tells people what to plant, tells people what to do for work.
Who you can marry now under the new
exactly.
laws and regulations.
Who can you fall in love with?
Who you can fall in love with, yes.
And so that must be a serious issue there. Could you give us kind of a range of the projects currently that you're doing in Lebanon, just briefly? What are the categories you're focusing on right now?
Okay, one of our, so we focus on a number of issues. Our biggest focus has been for many years education, because we believe on the foundation of education as the road to livelihood. And so education, but during the crisis, we also expanded work under food security because of the situation. So we added food security as a main focus, energy, especially renewable energy. So with a focus on Palestinian camps. Because access to energy, renewable energy, is the source for sustainability for many of our local civil society organizations serving in the Palestinian camps and outside the Palestinian camps. And I will talk about this in a minute. Other sectors that are prioritized as health, because access to health nowadays in Lebanon is a life-saving
particularly after the port incident,
Exactly.
a lot of the institutions
Exactly.
were demolished or suffered some serious damage.
And water sanitation is also a focus for us. So under these 5, if you want, categories, we serve populations. We focus on Palestinian camps as a geographical area of our focus, but also we do work outside the camps to serve Lebanese communities, especially the vulnerable ones, and Syrian refugees who are hosted in Lebanon since 2011.
Can you give us an idea about the magnitude, the size of the Syrian refugee population in Lebanon?
In accordance with the latest UNHCR estimates, it's estimated to be in the vicinity of 1 million to 1.5 million Syrian refugees.
For a population of?
For a population of 4 to 5 million.
Wow.
So... it's quite big, right?
Very few countries can cope with that.
Exactly.
Frankly.
We have the biggest per capita rate of refugees in Lebanon. But at the same time, these refugees in Lebanon, it's very peculiar, and because now we have a crisis that it's a Lebanese crisis in addition, but Lebanon has never been friendly to the refugees, you know, and there's a number of discriminatory laws against Palestinian refugees specifically.
Going back to 1948, right?
But they, Palestinian refugees in Lebanon are not allowed to work. They're not allowed to own property.
To do certain specific jobs.
Yeah, especially professional jobs, you know, and many other restrictions. So what has this done to the Palestinian refugees specifically, that I like to call in Lebanon the forgotten people? You know, focus has never been on the Palestinian refugees. Even the media doesn't cover them. And I don't know if you heard lately, there has been an increase in the number of Palestinians from Lebanon risking their lives to go to these illegal immigration through what we call the death boats. You know, smugglers, they risk their lives. Many of them go missing in sea or dead, losing all their life savings just for a hope of a new life, because their lives are so miserable with no future. Can you imagine somebody who doesn't have a future, you know? And this is the case, unfortunately, for many of the Palestinian refugees in Lebanon. Even if they get educated, the chances of them getting, you know, a decent job, owning land or owning a house doesn't exist.
Yeah. Now this is sad because it's kind of like escaping a miserable way of life into death. And the Mediterranean has turned into a cemetery. Mm-hmm. This last incident, of course, we read a lot in the American media, where more than 100 people have drowned, including, I don't know, half of them children maybe, or 1/3 of them children.
And the sad part of it is that this specific boat got attention from the media, but there's
many others
that didn't. And we have reports that many of these has lots of Palestinians on board.
Mm-hmm. Sandra, if I were to embarrass you and say, out of all the projects you have in Palestine today, what's your favorite one that ANERA is doing right now that you feel is impactful and doing great? I know they're all good.
Oh my God! You are putting me in a tough situation.
I'm going to put you in a tough situation. I've visited a lot of these projects on tours to the region. All the way from the north, from Jenin,
from Jenin to Rafah is how we work.
And
yes,
I've visited some of the projects in Gaza over the years. And if I were to embarrass you and say, pick one right now in 2022, what do you feel you are being very impactful at doing to meet the needs of the Palestinian needy at this time?
Okay, so again, I love all our projects, but something that's really it amazes me every time I go to the field and see this project is our rooftop garden project. So we are specifically working in Gaza, creating these rooftop hydroponic gardens for farmers and families where they feel that they've gotten back to the land in some way without land. And every time I have gone, there's a new crop that is being planted. We've planted strawberries, cherry tomatoes, cucumbers, eggplants, cantaloupes, watermelon. Somebody's tried planting quinoa. It blows my mind that in a small space of 60 meters, that, you know, about 150 feet, are we saying?
On the roof.
Yeah.
The roof, and you know that in Gaza they say that you know, ever since 2020 that the water situation will make it unlivable. We're creating a livable space using reverse osmosis, using a filtering system to create these gardens where families can not only provide for themselves, but they feed their neighbors. And then they use these also to barter and to trade and to sell to bring other needs. So I love all our projects. And really, I wish you'd give me a chance to speak about every single one, but I am blown away by every time I go to the Rooftop
Well,
Gardens
thank
one.
you for answering my question. So now a relaxed question.
Yeah.
Give us the range, again, similar to what we heard about Lebanon, the range of projects that you and your team are doing
Yeah.
right now in Palestine.
The team is doing an amazing work of looking at all projects. It is, as Samar mentioned, we work in WASH, so water and sanitation and hygiene. We work in education, specifically focusing on early childhood development, which is a neglected sector in Palestine. We work in community infrastructure, and this is another one of my favorite projects, to be honest, because we're providing jobs, we're creating spaces for families in community centers, health clinics, schools, and a lot of this work is being done in Gaza. We have economic development. We have a program that's amazing called Women Can, where we provide small grants to women anywhere from $2,000 to $3,000, and they create their own businesses. If it's a store, if it's a small catering business using the zarb, the underground underground oven where they cater to needs. We have women who are making cheese and raising cows. And then we have, of course, our medical donation program. And much like Sandra spoke about, it's a life-changing, life-saving intervention that ANERA does. So a large part of the work that we're doing revolves around medical donations, cancer medication, diabetes medication, medication for chronic illnesses, and of course, antibiotics. So those are that's a summary of the scope of and range of our projects.
Great. Samar, the situation in Lebanon you started describing earlier, and I did refer to it as an implosion. I mean, literally, the system has collapsed for all practical purposes. And frankly, all economic and political indications are not encouraging right now that we're going to see the light at the end of this tunnel. How does that impact the work of a humanitarian organization that is seeking to touch people in terms of their daily needs? How has it impacted your work, especially since that collapse? I mean, I had a friend, a former ambassador, frankly. He's retired. He called me the other day, and he said that his retirement essentially is about $4,800, the equivalent of $4,800. He said what he got from his, I don't know if he got it from the bank somehow, is the equivalent of $180 right now.
So.
How do you work, and what are you doing what can you do for these people today? I mean, people robbing banks to get their own money out?
Exactly. So this is why when we started, we said ANERA is bringing hope during this very difficult situation. So what we did, we immediately scaled up our support to Lebanon. So currently this year we have 28 projects running in Lebanon across the different sectors I mentioned earlier. And we scaled up our support. We're focusing also on livelihood as a sustainable solution, not only on relief, because we believe that by helping people earn an income or providing income generating opportunities, we're helping people become more resilient, and especially the youth, so they can support themselves and support their families. And at the same time, where needed, as Sandra said, our medical donations, our food security is also providing immediate support to people. So we're making this balance between immediate help through different programs, as well as sustainable development in many other programs, especially the Education for Employment program that I told you about. With this program, we saw that the crisis also has brought opportunity that we worked on. Many of the private sector companies lost their talent because one of the impact of the crisis was the brain drain in Lebanon. Many of its talented people has left the country. So we use this as an opportunity to join forces with the private sector, with the large-sized enterprises, and partner with them, where we're training new workforce and they're employing them. So through these programs, we're providing hundreds of youth, Lebanese, Palestinian, and Syrians with sustainable jobs. And this is helping both the private sector to sustain itself and providing employment for youth. So I hope I answered your question.
No, you did. Sandra, recently, again, my work is political, yours is humanitarian.
Yes.
So I don't want you to cross the line. Stay where you are. But let me say that over the past few weeks, I've been hearing in my work analysis of the political situation, people in Washington here, leaders, the White House, the State Department, Congress, people in Palestine, people at the UN during the General Assembly meetings that took place there, even leaders in Israel are basically talking about the situation in the West Bank about to explode. What are they talking about, and how does that impact your work here?
Yeah. Again, going back to the situation in Palestine, it is a political crisis that's creating humanitarian issues in our country. And one of the situations that we see right now, based on the fact that it's been years since there's been any progress or any development in Palestine, it's creating a lot of frustrations, a lot of anger amongst different parties. We see in the West Bank, especially in the north, in Jenin, in Nablus, in Salfit, that there's a movement happening that we have not seen for decades. That we haven't seen it since I don't know when we last time we saw it, but armed resistance. Since the first Intifada, the kind of demonstrations that were happening were nonviolent demonstrations that ended up having violent consequences, of course, but it was led by nonviolent demonstrations, nonviolent activism. And what we're seeing now, due to the humanitarian situation caused by the political crisis, despair and loss of hope and frustration and anger. And it's not just frustration and anger by the occupation, it's frustration and anger by the occupation, our own government with the PNA, it's with the international communities that are turning a blind eye to what is happening in Palestine. There's other crises. The crisis in Lebanon that we've been talking about is extreme, and there is a lot of attention in Lebanon happening on that. What's happening in Ukraine? There's a lot of things happening in Ukraine right now, but that makes the situation in Palestine less visible and less attention given to it, and it's getting worse with the violence and the escalations, but nobody's doing anything to stop that.
Yeah, it's sad that all these politicians referring to that threat, and all they're talking about is how do we control the situation to maintain the occupation, rather than let's look at the root cause. Yes. Why is this despair showing itself like in Jenin and in Nablus, and particularly in refugee camps? Is this surprising to you that the core of where this conflict is re-emerging is in refugee camps internally in Palestine?
No, because if you look at the living conditions in refugee camps, there isn't a proper road system. Infrastructure is shoddy at best. Healthcare and healthcare provision is lacking. If there is a clinic, you will find that people are waiting in line to get any kind of support. And if they do get in, maybe the doctor will give them 1 minute of their time because they're trying to move the numbers so quickly. Education, schools are overcrowded. We can talk about the refugee camps in Gaza, for example, where they operate in 2-3 shifts. In Palestine, they don't operate in 2-3 shifts, but you have 40 children in a space of 10 by 10 feet sometimes without windows, very, very difficult situations, crowded situations. So it doesn't surprise me because some of the hardest areas are the refugee camps. And with, the last administration and the cut to UNRWA, the United Nations Relief Workers Agency, has not really bounced back to provide more support for that. The needs are great. The money is decreasing. The frustration is there.
Yeah, and unfortunately for us, here who are working on this issue, there are more and more voices rising in this town asking to simply abolish UNRWA.
Yes.
Because they think, or they're accusing UNRWA of fermenting the situation and actually adding a dimension to encourage, if you will, refugees to continue as it. And they forget the real reasons,
yes.
Historically, how the refugee problem emerged. Let's conclude with the same question to both of you. I would like for both of you, if you don't mind, to focus on the future. On Saturday, the board is meeting, right? Yes. And your report have been submitted. Members of the board have looked at it, and they're looking at what future projects is ANERA going to undertake based on your recommendations. What are you recommending? How's the future of your work in Lebanon going to look like?
On the short term for next year, we see that the situation in Lebanon will not improve. The future looks bleak, it doesn't look good. So my recommendation to the board is to continue to scale up our work and especially on scaling up our food security programs, especially the agriculture part, the rooftop gardens, as well as farming. Renewable energy is to be prioritized because it's a big need. And we started this year with supporting 26 health centers, and this has enabled them to continue serving the population. We have a target of equipping each camp in Lebanon, Palestinian camp, at least 11 centers in the Palestinian camps to have, renewable energy. So we sustain the education and community services in each of the 12 camps in Lebanon, as well as continue to work in supporting health and education as we're doing now.
The future of your work in Palestine?
It's very similar. I believe that for the next year, what we want to focus on, one thing that someone mentioned is the rooftop gardens. For me, it's also linked to regional work, how we can learn from each other from Lebanon and Jordan and Palestine. And we're actually just submitted yesterday a project where we're looking at peace through sports that Lebanon has been implementing that we would like to do here. There's so much learning happening in each of these countries, and how can we pull that together to have a larger impact? That's one area that we're going to be focusing on, regional work, and how we can support each other by the lessons learned in what we're doing. Community infrastructure, extremely needed. Need to keep moving in that work in Gaza and the West Bank. Unfortunately, our latest community infrastructure program was funded by USAID, and we weren't able to work in the West Bank as we were able to move in Gaza. I would love to see that nationally. I would love to say that our community infrastructure program has different donors, support from donors that have made ANERA what it is. By the way, $1 billion in the last 55 years is what ANERA has done in the region for Palestinians and other refugees. And I want to also look at the WEF, what we call the water, energy, and food security nexus. So looking at these very things that Samar was talking about, how we improve water. Gaza Gaza doesn't have drinkable, potable water. So we're really focusing on reverse osmosis and providing clean, safe drinking water for our communities. Looking at energy, renewable energy, whether it's through recycling or solar panels, and also tying that to food security, because the humanitarian crisis, more people are food insecure, much like Lebanon, more new poor that we're seeing same chronic poor. How do we develop programming and support to those people that most are in need?
Thank you, Sandra. Thank you, Samar. Appreciate your being with us today, taking time out of a busy schedule here in Washington and the event of this weekend, the annual banquet and the board business. And we thank you so much for doing essentially God's work in Lebanon and in Palestine with your staff there. And some of us, at least here, do appreciate the work that you're doing. By the way, Samar mentioned earlier that the situation in Lebanon is bleak, but that doesn't prevent organizations like ANERA to continue its hard work. And I did mention, as a supporter of ANERA and longtime board member, very proud of the fact that ANERA's contribution this year to the work in the region exceeded the $112 million. And wanted to specifically mention something that very few people know about, that out of that amount, 80, 82, up to 85, I think, is going to be this year, in-kind medical contributions. And that is making a big difference in areas, particularly like Lebanon, particularly like the West Bank, whose health systems have essentially collapsed and are really in need of serious support. So to those of you who watched this interview, look up ANERA on the internet, anera.org, and become a supporter of this very, very valuable work. Thank you so much for watching this program. Thank you both for being with us today.
Thank you.
Thank
Khalil,
you.
can I say one thing?
Sure.
A plug. Look us up on ANERA.org and look us up on other social media channels. We're on Instagram, we're on Twitter, we're on Facebook, we're on LinkedIn. Please look us up and see the amazing work that we're doing under such challenging circumstances.
Thank you very much.
Thank you.
Thank you.